Good morning. I'd like to call this meeting to order. The clerk has advised that we do have quorum. Please join me in the national anthem. Members, please observe a moment of silence in memory of the following persons who have passed away: Natalie Bozo, Frederick S. Eaton, Jerry Graves, Walter Gretzky, Bernie Himmel, Timan Ho, William Cassell, John Malich, Mario Paluzzo, Sister Ann Schenk, and Tina Stewart. Thank you. We acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. For the benefit of those who are connected to the internet, the city clerk has posted all of the agenda materials for today's meeting at toronto.ca/council. Members, although civic buildings, including City Hall, are currently closed to the public, I want to emphasize that today's council meeting is being considered publicly and is being streamed live on YouTube. I want to welcome the public who are watching out this meeting this morning. Today's special council meeting is scheduled for the following purposes: to consider deferred matters from the February 2nd, 3rd, and 5th, 2021 meeting, to consider reports from the community councils and the Planning and Housing Committee, to consider new business and member motions with notice, to introduce and enact general bills, to introduce and enact a confirming bill for the special meeting. Members of council, this is a special meeting, and under council procedure, no new business items such as motions without notice may be introduced. This rule cannot be waived. Members, I would like to call upon Mayor Tory to address council at this time.
Well, Speaker, thank you. Before we proceed with the business of the day, I think it's appropriate, given that we're meeting today, the national observance is tomorrow, and there's a month of different kinds of activities in this month of March to commemorate the fact that this pandemic has been with us for a year. And in fact, if you look back, the beginnings of it happened before that. And we are marking in the city and in the country in different ways an event that has changed the world and has changed certainly the way that we live and all the people that we serve and that we represent. I'm speaking to you as mayor in the hopes that together with residents across the city, we will take time over this month to mark milestones, some of them very sad, to thank people who have helped us throughout what has been an incredible experience, I think, unknown to all of us in our respective lifetimes. It's an opportunity, I think, for us to acknowledge how far we've come as a city and as individuals during a time that has put burdens and responsibilities upon us that we never probably thought we would have. You know, I think if we're honest about this, a year ago we were immersed in meetings already about things like PPE, and that's an expression that probably a lot of us hadn't used in any different respect, but we're starting to worry about gowns and masks and so on. We are, you know, ramping up the emergency operations center. I think, in fact, it was exactly a year ago today that it was ramped up and put into action. And I think that there was a hope probably at the time, if we're all sort of being honest about this, that we would think this fits into the same category. We're so blessed here in that we don't have earthquakes. I shouldn't say that but we don't. And we don't have hurricanes and natural disasters the way they often do on a regular basis in other parts of the world. And I think maybe a lot of people thought, well, you know, maybe that just won't happen here. But it did. And what we've seen since is, you know, a resilience that is like no other test we've probably ever faced as a city and as a people. And of course, the fight isn't over yet. So in that sense, it's resilience that still has to be at the forefront. The vaccines, plural, do bring us a sense of hope and relief. They are a miracle of modern science that we never could have expected to happen in such a short period of time. And I think that all of us have felt a certain sense of relief, and hopefully even more so than ourselves, the people that we serve have felt a certain sense of relief in that the supply is on its way from the government of Canada and from the government of Ontario. And the fact that I think as of today, 211,000 people in our own city have been vaccinated, including a solid start on some of our most vulnerable populations, including people over the age of 80, with more to come with some of the announcements we've made about the mass immunization clinics starting next week. And I hope that this will help what the task has been since the beginning, which is to save lives, to keep people healthy and bring an end to the pandemic so that the terrible toll that's been taken, whether it's on people's mental health or on business, can be reversed. The work is well underway, as you've seen, on the largest vaccination campaign in the city's history. And it's just one of the Herculean efforts that our staff have undertaken in the course of the past year. So I think we also have to reflect, though, on the fact that while it's good to talk about this sense of hope as we approach spring and as we approach the time of renewal on the calendar, that we have to reflect and acknowledge on the difficulties that we've experienced as a people and as a city over the last 12 months. We have faced a loss that was unimaginable. And, you know, I'm often engaged, as some of you may be as well, in these debates about some of the difficult decisions we've had to make about the economy and about shops and businesses and so on. And I have to repeat, you know, the fact that we have lost, we're literally one death away, I hate to say, from 2,700 people in our city. And if you think about it in the context of every other issue we face when we're trying to save lives, which is one of our principal jobs that we have to do, myself as mayor and all of us as members of council, it's to save lives, and it's to protect life, and it's to protect health. And 2,700 grandfathers, grandmothers, sisters, and children, and loved ones, and friends, and colleagues, and neighbors have been lost to this virus. And it's a toll that nobody ever would have said was within our conception when, you know, we started off with this, because I don't think there's anything that's ever happened before, short of world wars, where those deaths have taken place out of the country. And that doesn't make it any easier, but it just means there's nothing that's probably ever happened at home of that scale. And so tomorrow, as the Government of Canada acknowledges the lives lost across the country through the National Day of Observance, I trust that we are thinking today, as I know we are, as we sit here and meet as a council, about the loss of life that has taken place and about everyone who has lost someone because of COVID-19 in Toronto. And while we mourn those people, we also must acknowledge, as we do, the sacrifices and the losses and the troubles that have beset many different people in order to save lives and keep people healthy. And that includes the business community, where many people, individual people, the mom and pop couples and partners that have suffered a tremendous sacrifice as a result of what's been imposed in terms of public health restrictions. And I know I speak on your behalf in saying that we also acknowledge and pay tribute to the incredible acts of kindness and commitment. I've said in a couple of the interviews that I've given how proud I am to be the mayor, and I'm sure you're proud to be councillors in a city that has demonstrated not just a caring and concern, as we said from day one, that we would make the gold standard effort to look after our most vulnerable populations. And it hasn't been perfect, but I know from participating in panels with mayors from around North America and even internationally in Europe, that people have looked to Toronto for a number of the things that we've done through the pandemic as an example of how to make sure you try to do it right. And I think we've done so. People from all over the city have come together to help one another. And I was commenting on this last night in talking in one of the public meetings about the modular housing, that you've seen, the spirit that can pervade the city, a positive kind of spirit. People prepared to follow public health guidelines, but also to understand that those and the pandemic itself impose certain burdens on populations that just need our support. So I want to say thank you to all the residents and businesses who have done the right thing, followed the public health guidelines, perhaps most importantly, though, have stepped up to help each other and to support each other. For those people, their commitment to this fight has saved lives and has made a difference and has really demonstrated more than anything else I've probably ever seen in my own life of Canadian and Toronto values at work. And it's why we're able to move to a better future. Had we not taken the steps we've taken and helped each other, we might be looking at the prospect of months more of lockdown or a much greater loss of life. Of course, I want to thank on your behalf again, members of council, I want to thank the frontline workers. And I said in something that I was preparing for this day, the other day, that our definition of a frontline worker has been changed. And I looked it up, and of course, I don't have the definition in front of me, but it talks about sort of a person playing the most important role in a given action. I think, and we thought of that always as being healthcare workers and doctors and nurses, and this is not to diminish what they do at all, but we've added a lot of groups to that list of people who we realize are more essential than perhaps we thought, and our frontline workers. We've been tested in our ability to work quickly and to work effectively. I call it wartime speed, and that's a phrase now well known to the command group that meets every single morning. I think that the results have shown it, and it's been as a result of a huge effort by people to make sure that we do that. And that's right across every single division of the city government. Every single staff member has been involved in one way or another, contributing to wartime speed, to compassionate, effective government, and to making some sacrifices themselves as we've gone along. Whether it's Toronto Public Health or whether it's the people at the EOC, whether it's the shelter teams, it's dangerous to start in with lists. The people who work in long-term care who have had unbelievable challenges put in front of them, not to mention the residents that they care for. The list goes on. People who drive buses, everybody has contributed because they've had to do things much differently than might have been the case in non-pandemic times. And I want to acknowledge in particular the people who we would normally refer to when we talk about frontline responders. Our paramedics, our police, fire, municipal licensing and standards, 311, solid waste, parks, forestry, and recreation, all of them have done, again, work that has been extraordinary and worked at wartime speed. When you think about some of the initiatives we undertook in the face of an unknown, to make public spaces more available, to make them safe, to do different things like that in the parks, forestry, and recreation realm, and to do it with incredible speed, they deserve our thanks. The drivers at the TTC and the other people who work on the TTC, even people who keep the buses and streetcars and so on running. I mean, we had to have that connection available for people who had to continue to go to work. Some of them, the very same essential workers that we're talking about. So I think, when we look back at this and look at what the people in public service and the people in partnerships have done in the communities and individual citizens with government, it is something to be proud of. You never want to say you're proud of something that happened during a very tragic kind of event, but I think that it's how you respond sometimes that you're measured when it comes to these kinds of tragedies. And there's been such dedication and courage and resilience shown by everybody, but including people in the public service and including people in the community organizations that we've worked so well with. And boy, they asked me one of those interviews the other day, I'm sure you all don't like these questions much when they say, well, give me one word that can sort of sum up, what you think has happened in the pandemic. And I picked the word partnership. Because in the end, whether it's partnerships with community organizations, with each other, with governments working together, it's been extraordinary, the partnerships that have been forged and hopefully can stay in place. So thank you to the members of council as well. I think that you've put up with the fact that a lot of decisions have been taken at the command table, in the mayor's office, in various places over time, and they had to be taken quickly. Decisions had to be taken in terms of our partnerships with other governments quickly because we had to move quickly. And there wasn't always the time or the opportunity to have a council meeting or to call every single person. And, I apologize for that on the one hand, but on the other hand, You've been very indulgent of that. And I think we've ended up in, by and large, the right place with lots of information coming from particularly the public service to you as we've gone along. I want to make, as I just reached the end here, I want to make particular mention of 4 people who have formed a part of the leadership ranks, and just to say to them what they know to be the case, which is my own immense gratitude. I know it's yours, and I hope they feel it from the people of the City of Toronto, and that is our Chief Medical Officer, Dr. Eileen Davila. You know, I didn't know her as well, obviously, before the pandemic. Now, perhaps she might say that we know each other too well in the context of this daily, unending, dialogue. And it's been very much a dialogue and a mutual sharing of information back and forth between all of us on a team. But she is just a consummate professional. She's calm, she's steady. She has a great sense of humor that can be put into play at the appropriate times, because you need some of that too, as you all know. Chief Peg, same thing. I mean, we went to the meeting maybe the second or third day, and somebody said to me, well, this should be the person that you kind of make as the incident commander. And I'm thinking, well, it seems odd in some respects, not because of him, but just, it seems odd you'd pick somebody from that realm. And then he got up and made a presentation about how you just go through things step by step by step by step, and just in an organized, methodical, collegial way. And he's just been outstanding all the way through. And again, the team has worked well together. City Manager Chris Murray, again, a rock. He is such a collegial professional person and has called together a great team, including our deputy city managers and everybody else, and has kept them together and I hope kept you informed, because it's one of the things that we've called upon him to do. And so again, just a person that's been terrific to work with. And finally, our colleague, Councillor Joe Cressy, the chair of the Board of Health, who has been, again, just a solid team member, helping us in a way that you'd always hope government could work, and especially at the political level. We all know, I mean, politics is a funny business in terms of the odd way in which people sort of work together. Sometimes they do and sometimes they don't. Joe has been terrific as a person that has been a resource to us in many different respects to get the job done here. And that's not to exclude anybody else by mentioning those 4, but those are people that I have worked most closely with in trying to do the best we could for the people we serve and for the city that we love. We're all tired of this, frankly. I mean, if we're being honest about it, the people are tired too. I mean, they're very tired. We're ready to jump into spring. The vaccines do give us hope. And so we'll spend some time over the next few days, and the city will have an appropriate commemoration in just a few days on the anniversary of the first death suffered in Toronto from COVID-19. But I hope we all will spend a bit of time, and I hope the people that we represent, some of whom are able to watch us today, will spend some time thinking about loved ones that have been lost by others, and in some cases by them, and to continue to help us lift up those who are continuing to struggle. Some were struggling long before the pandemic, and they've had to struggle worse because of this. Others have only struggled during the pandemic, whether it's through mental health concerns or just the illness or any unemployment, hope of other things. And we thought it would be appropriate today, just as part of this short but hopefully meaningful commemoration, to ask our poet laureate, Al Moritz, who we've all heard. He just seems to be able to, and I'm sure he will again today, bring the right tone and the right words and that's why he's the poet laureate. People sometimes ask, why do you have one? Well, today represents one of the many answers that we have for that. And he's put together a poem to mark this incredible pandemic year and our collective journey that we've taken together. And I think it's a poem that will resonate with many as we continue to grapple with this most unprecedented, extraordinary challenge. So, Poet Laureate, over to you, and thank you so much for creating something for us today and for coming to share it with us in person.
Thanks very much, Mr. Mayor. This is a great opportunity and, of course, a great responsibility, but I take joy in being able to address you here today, and I hope it's something at least marginally worthy. The title of the poem is Exactly Here the Marvel Spoke, Memorial of a Plague Year, March 2020 to March 2021. You staggered from death to death. You dragged yourself from the silent window where an old face looked out and knocked with twig-like fingers at children trying to shout in through the crystal silence. Grandma, Babushka, Aljida, Babcha, Nani, Daddy, Abuelita, Nana, Bobe, Ba, Najimama, Nona, Bati, Jiajia, Abo. The cries broke on all the walls and forbidden doors of well-meant homes of rest. And how you longed to go in to sit by them, hold them each in their dying, how you longed for death to be again as it should be, the dying one among us. And exactly here the marvel spoke. Your eyes grew clear, you were holding them. In your shattered longing, you grasped them. The dividing plague could not divide. We remained one. We still died with the dying, they still lived with us. In yearning, in dreams, in truth, we hugged the fallen silent head. And then, worn out, scarred from the crushing labor, the sweet duty of companioning our dead, we go back to daily things, our daily bread. And later, working, aching, we notice through our pain, we are slowly happy again. Broken, we find a silent bearing of the dead inside us, like a child newly conceived, like an immense and beneficent idea, gift of refreshment to the world. We just begin to glimpse it, a new health. We can't yet trace it clearly, but the work inhabits us with passion at lonely desks or in companionable walks in living rooms and discussion halls, laboratories, councils, factories. We work, we see another world. Our dead are with us now more wholly. With them, within us, we're going to know them face to face again, as we did before on the poor beloved earth. So we go forward through our home, Toronto, meeting place, and every tree and corner, every shop window that our grandmother knew. Every neighbor who once loved to talk with her, who always stops us to recall the same tender story, is a star now, a star of soft, radiant memory, a star of light from the past for today, of light from the dead for life. I wish I could put my arm around your shoulders, be beside you. Soon. For now, though, plague still stares between us, and yet we don't have far to go to reach the utmost sobs of the splintering universe, and with our hug, bring them all back together, assemble them here for a parliament of loves. What's beauty and sorrow for? What's poetry for, if not to bring us near while we're alone until our lips and hands touch? I can gather all because I listen. I can hear you, speak with you, hold you in my heart. You are more than the helpless universe. We reach and bring everything that has burst, broken, died, left us, fled from us, everything frozen in the space of death, back into the loving quiet of a brook returning in late winter to the young life of purling water. It's March, winter kisses spring. We don't have far to go, only from dusk to morning, to gather the fragments of disaster in music and tears. I see, hear, love the men and women all around me. I'm with them. I am here. I hug them in the body of my song. Thank you.
Thank you. Thank you very much. Okay. I'd now like to ask Councillor Matlow. I understand you wish to make an announcement at this time.
Thank you, Madam Speaker. I have the very unenviable position to try to speak any words after that presentation by the poet laureate, and we are so grateful for those words. Incredibly touching and so beautiful. But I also have the great privilege to acknowledge another person who deserves this acknowledgement, which is the outgoing now interim general manager of senior services and long-term care, Paul Raftis. There is no group in our city and around the world that has suffered more than the residents who are served and reside in long-term care homes across this city and across this province. They have been the vast preponderance of fatalities. Between 60 and 70% of all fatalities have been in long-term care. And Paul accepted his role as interim general manager in 2019. Before the pandemic, he already demonstrated that he was able to pivot very swiftly and capably from paramedic services to this leadership role by transforming the division, including long-term care homes, municipal service planning, coordination, and management of senior services across our city. When we as a council asked Paul to provide leadership in bringing an emotion-centered focus to long-term care, he took that role seriously with dedication and has been providing leadership through the pilot that we requested that he